You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. Despite the advancements in medical science, many seniors still face biases and barriers that impact the quality of care they receive. From overlooked symptoms to limited access to tailored treatments, ageism in healthcare can have real consequences on a senior's well-being. But families can play a crucial role in bridging healthcare gaps. In this episode today, we are talking about how seniors can be supported by loved ones, advocate for better care, and help them thrive in a healthcare system that isn't always designed with them in mind. As well, we will discuss how technology can serve to empower families, caregivers, and communities to make a difference. Our guest today is Dr. Tina Sadarangani, and she is a PhD-prepared NYU Assistant Professor who is board-certified adult and geriatric nurse practitioner. Dr. Tina's expertise includes family caregivers, adult daycare services, older adult nutrition, age tech, and addressing the long-term care needs of ethically diverse older adults. In addition to being a clinician, Dr. Tina is an NIH-funded scientist focused on aging and a tech-innovator. She is also a sandwich generation caregiver with aging parents and young children. She is passionate about social determinants of health and helping families navigate the healthcare system. She is a proponent of health equity and has published extensively in this area in peer-reviewed academic journals, including in the American Journal of Public Health. She has been recognized as a woman of distinction, rising star in long-term care. She attended Georgetown University, from which she graduated Summa Cum Laude, completed her master's at the University of Pennsylvania, and completed her doctoral and post-doctoral training at New York University, where she graduated in the highest bracket of academic preferment. Dr. Tina created an award-winning mobile application called CareMobi out of her NYU lab that helps families, particularly those in which someone has dementia, communicate around the day-to-day care of their loved ones. She is also the creator of the Enlightened Caregiver, a social media community, which provides families with practical tips on how to get optimal, not usual, care for people that they love. We discuss, amongst all the things that I've just talked to you about, pinpointing some of the highlights of this episode, we discuss why she chose to go into this area of study, how ageism is implicated in the healthcare system, and how healthcare changes in recent years when it comes to the role and expectations of patients and families in the healthcare decision-making are evolving and how they are changing. Please stay tuned. We will be back in just a few minutes to talk with Dr. Tina.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub. We'd love you to follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on all those locations, I should say X. Dr. Tina, welcome to the show.
Thank you so much for having me. I'm so excited to connect with you today.
Well, I think you offer so much. Yeah, I look at social media as I'm popping through things to see what is forward moving in healthcare, and we're not going to focus on ageism specifically, but definitely geriatric medicine, focusing on quality of life is something that is, I think, becoming more positively focused. And maybe you could comment, start right there on that. Do you think that that is the case?
Yes, absolutely. I think we're getting to this concept of, you probably have heard this word, used more often now called well span, right? So
Right.
we historically have focused on lifespan. We all want to live longer. We want to live till we're 100. Great. But we really now the focus is on living better and maximizing our function and maximizing what we can contribute to the world and maximizing how engaged we are and being able to do the things that we love and we enjoy as long as possible. And so, this focus on quality of life, it's very interesting. I think historically, we almost put quality of life in this bucket of, serious illness and how do we maximize people's quality of life in the context of serious illness. But really, I think the conversation now is really focused more on prevention and how do we live better? How do we increase our well span, the number of years where we're functioning at maximal capacity? And as I said, doing the things that we enjoy. And so there's been a bit of a reframing, which I think is really, really wonderful.
Well, I guess, in layman's terms, and the sort of the poke word now is called longevity.
Yep.
Um, but there is, within the healthcare system, maybe you can elucidate this for us. Does the age of a person affect the healthcare and the attitude of healthcare givers that elderly people are receiving?
Yes. Oh my God, yes. And that's something that, number one, really desperately needs to change. And as
Hmm.
someone who educates nursing students and medical students, it's something I try to ingrain with them. We often look at the age of the patient and then start making decisions from there.
Hmm.
But every 80-year-old is, not one 80-year-old is very different from another 80-year-old. One 90-year-old is different from the other 90-year-old. And that's where I really encourage people, and this is why older adults in the healthcare system and so much about of the work I do is about advocacy for them, advocacy by the caregivers, advocacy by the people who sit next to them at that doctor's appointment. Because too often, to your point, we look at their age and we just say, oh, you know what? You're 85. We're not going to treat that. But if
Hmm.
you're 85 and you're running marathons, we want you to be doing that as long as possible, right? And
Yeah.
so there are, I think a really, it's very important to have a solid relationship with your healthcare provider. But more importantly, it's important to tell your story. What are the things that you love doing? What are the things that matter to you most? And working with your healthcare provider to make sure that you do them. And for everybody, that's looking very different depending on their age. My mother's best friend is just about to turn 90. She travels independently across the country. She does all kinds of things. She's going on a cruise later on. She's still working and seeing patients. I mean, the woman is remarkable. And so, I wouldn't just say, oh, she's 90, therefore we shall stop. She has a very productive life and we need to keep her functional as long as possible.
And again, I don't think we value the wonderful experiences and the place in society of people who are north of 60.
Mm.
It just doesn't seem to be a value that we place here in North America. Do you see that changing?
As we see this population, first of all, the growth in the population of older adults is unprecedented historically. I absolutely think you're right that, there's ageism is rampant in our society. Do I see that changing? I think it's going to, I think it needs to change. And I
Hmm.
think it's there, but what I haven't seen enough of is enough education, public awareness, rebranding around this. And what I do like to see is in community settings, more emphasis on senior fitness. The other interesting thing you point out is that you talk about this in the context of people over the age of 60. What I am seeing is that People will say 60 is the new 40.
Mm.
With people living longer, we are changing our perspectives on what people can and should be doing in certain phases of their life. I also think 60-year-olds, for the most part, don't view themselves as older people. And I think it takes a long time in life for people themselves to have a realization that they're considered old by society. So there's going to be demographic shifts. And I think it's trending more positively. I think, as I said, 60 is the new 40, this focus on well span. It's not about how old you are. It's about what you're doing, what you're contributing. I tell people all the time that one of the secrets to longevity, in my opinion, is to work as long as you possibly can and to remain engaged as much. And I really do think that contributes to longevity. And we're seeing older workers, stay in the workplace, which is, I think, a very good thing. However, what I am not seeing, to my earlier point, is sort of a focus on anti-ageist practices. I think we're hearing about it a little bit more, but we need to see these individuals continue to be wrapped in the fabric of their communities, engaged, productive part of things. And only then can we stop marginalizing older adults, which is frankly what I think still happens to this day.
Well, I agree. And I think people will begin to think they're older as a reflection of other people's projecting on them. We built in memory loss, we built in slowing down to so many aspects of aging that, you start to think twice about things. Like I'm 60 and, I'm thinking, am I losing my mind or is it, and it's funny because I'm kind of thinking that maybe that is just a function of aging, but I don't believe that. I personally don't believe that. But it has slipped across my brain barrier that, maybe things are not sticking as they used to. But I also feel that it is a projection. Like younger people have this, my parents are getting older, therefore we should prepare for this and things are going to change. And I just don't think that that is actually so. But before, that's sort of where I want to put a bow on that aspect, because you do so much with respect to patient care, family care, supporting family members and caregivers. How did you get into this space of healthcare?
Yeah, so it's really interesting. My career journey has taken many twists and turns. I started off as a college anthropology major, never with two doctor parents who said never go into healthcare because the system is so broken. My parents used to say that when they took the Hippocratic Oath to do no harm, they simultaneously vowed to never let their children enter healthcare. But I'm a third kid, so I don't listen. And in my final year of college, I had the pleasure of taking a course on death and dying, which actually gets to the exact topic we started this conversation on. It was the first time that I learned that people in this country and across North America are living longer, but they're not necessarily living better lives. So gets right to what you're talking about. I was fortunate to have two, as my parents worked quite a bit when I was growing up, my grandmothers were the ones who lived with us. And so I have two super aging, extraordinary grandmothers. One is 103, the other is about to turn 100 this year, who were very solid presences in my life and my household growing up and spawned a love for older adults. And their care. And so when I learned this fact, I really went into healthcare and I was fascinated by the broken nature of the system that my parents talked about. People being at the mercy of health insurers, providers being burnt out. Of course, I went in bright-eyed and bushy-tailed as an adult and geriatric nurse practitioner, thinking that I could too function within this system. And eventually, what you realize is that you can continue to give patients the best possible care, and yet they will keep coming back because of a flawed system and not getting the support they need to actually implement the aspects of the care plan that you suggest. And so the real reckoning for me, I went on to complete a PhD and a postdoctoral fellowship, really focusing on how we can improve health systems for older adults. But what has changed my course and my advocacy on caregiving was when I actually became, quite recently in the last couple of years, before he passed, a caregiver to my father, who, after a bout with COVID, developed end-stage kidney disease, and went into kidney failure and had to be placed on dialysis. And what was fascinating is that, as I said, I have doctor parents. I'm, trained as a nurse practitioner. I have a PhD. We have all the knowledge in the world, and yet we found caring for him incredibly complex and keeping him at home. There were so many moving parts to his care, his appointments, his nutrition. And it is a real awakening when you are sitting on the other side of the table, when a provider is telling you, okay, make sure you watch his diet and make sure you take him to these 6 specialists and making sure that you do X, Y, and Z. And you're thinking to yourself, well, I have a job, I have 3 kids, and I have to single-handedly keep this individual alive and well, and do all these things, which is really truly a full-time job. And so it became very clear to me in that role that we have very high and an unfortunate, very unreasonable expectations of family caregivers. Who don't have the training, support, and resources they so desperately need. And one of the key things that I've done and how I've gotten here in thinking through technology is I focus on also digital solutions, because when my mother and I were caring for my father, she would have a notebook. We were exchanging text messages, and communication was getting lost, and his healthcare became a game of telephone. And so really where I've come now is working to help family members become more effective advocates for the care of the older adults in their lives, and especially using digital technology, including an app that I developed out of my research as well. So that's really how I've come to this point in my career.
So, okay, just a point of reference here. You're working a lot with the caregivers. Now, at what point do you feel that an elderly person cannot take care of their own health?
Yes, that's a very good, and I don't think there is a single point that at which we can just easily make that decision. I think there begin to be signs of self-neglect. And again, what I always tell people is that you want your loved one functioning independently as long as possible.
Mm-hmm.
Right. So whether that's walking, whether that's going to mahjong, whether that's going to bingo, and I'll give you an example in my own family with my grandmother. She went to an adult day program. She was living at home. She was living her best life. She was so thrilled, but she fell and broke her second hip. And at that point, my father was on dialysis. It became very challenging for my mother to take care of them both. And the decision was made to place her in a nursing home full time. That was a very challenging decision for our family, especially culturally. There was a number of reasons. Did she necessarily need to be in a nursing home? Could she have been kept at home? Could we have brought in somebody 24/7? Maybe we could have. The issue was that I felt was that she needed to be in a place where she was forced to productively engage, where she had outlets, where she had social outlets. She was not going to be able to continue getting down the stairs of our home into the bus to go to her day center. And that's what mattered to her the most, was the social piece. And so the placement in the nursing home we didn't wait till it got until a crisis situation. We wanted her to maximize her time, to feel that she had friendship, that she had peers. We thought long and hard, visiting different places, interviewing the staff, and catering to her personality. But this question of, is there a single right moment? No, but that was the time. And we could have kept it going longer. Many families can. So when we talk about the decision, it's not just about the person in question, but it's about the family. And when I advise people on more support, what is that more support? Is it simple? Is it just, do they need help with meals? Is it just the occasional transportation? Or is it that they're unsafe at home? Is it that they're at high risk for falls? Is it that if they fell down, nobody would be there to help them? Is it that if nobody brought them a meal, they wouldn't eat for 3 days? They can go on like this, but the idea is that the earlier we intervene by providing more supports, the longer we can maximize the function and their ability to stay at home. And so that's how I like to think of it, on a continuum with multiple different variables, and the family who's going to be, or the individuals who are going to be supporting this person, being factored into that equation.
We had to put my father, before he passed, into a nursing home. And we also had my father-in-law in a different nursing home. My dad did not want to go. He was less functioning than my father-in-law. My father-in-law chose to go.
Mm-hmm.
The difference between the two living situations was extreme.
Mm.
And what it told me was, now my father was ill. So there's that was the big factor. Okay. He was ill. My mom couldn't take care of him. But being present within the home, was a huge piece of how my father was respected, of even as declining function, of how my father was respected and how, his care was given. So family is an important part, extremely important part of proper care in most facilities. I just think that it is so. I have no science behind it. I just believe from what I've seen, it is so. We saw many people that weren't visited at all. My dad had family with him all the time.
Yes.
But the other thing, more towards what I wanted to point out, was my father-in-law asked to go into a home. And this wasn't, a home where he was, wheeled into a room and sat there for, most of the day. This had a library, a gym. It had a games room.
Yep.
And it helped him to socialize. And, I think part of the, just before we come to the end of this segment, what you were talking about is discussion. And, I don't have the science behind it. But when the will to live is shut down for whatever reason, then the aging happens tenfold.
Yep.
And my father-in-law loved it. And he asked to go there. And I think that all that needs to be a part of conversation. In my own opinion, do you see that as well?
I absolutely see that. It's, again, people need a reason to get. What if, and again, there's science to this in a way that's more articulate, better articulated than what I'm about to say. But the fact of the matter is that for longevity, people need a reason to get up every morning. They need a purpose. And they need a sense of purpose and they need a sense of meaning. And it is not about, necessarily the fanciest facility or the coolest, most high-tech activities, but it is about those things, what we're learning as a process to discovering meaning and finding purpose. And family support is part of that. And so what you said in that latter situation of continuing to surround them with love, it is not further marginalizing them. It's not dumping them. It is acting in their own safety and really having these conversations early on about what they would want, and there is going to be with any individual a period of adjustment. It is not an easy or smooth transition ever, I think. But the idea is to understand that this is about health promotion and maximizing function and safety, and that this person is safer and better off than they are at home. I know that every older person wants to stay at home, but to me, having an aide come visit you 3 hours and then having you be socially isolated just so you can stay in your house is actually a less healthy and productive option for your longevity than I would say going to a nursing home where you feel like you're part of a community, to be quite honest.
Absolutely. Okay, everyone, we're going to take just a quick break and we'll be right back to talk further about this topic with Dr. Tina.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to our show. Dr. Tina, how can families become or prepare themselves to become involved in the healthcare system with an elderly parent?
Yeah, absolutely. This is such an important question. And I want to say this loud and clear. We need to start having conversations early and often with our parents. And, it's funny. One of the things that I provide on social media is an Instagram and Facebook account called The Enlightened Caregiver, where we talk about in short snippets how we can have these conversations with our parents. And one of our favorite posts is how to talk so your aging parents will listen. And one of the key things here is that we want to not wait until our family or family member is in a crisis situation. And we really want to look for signs that it's time to start these conversations. So if you have a loved one or an aging parent who's over the age of 75, if your parent is not 75 or they've recently experienced a hospitalization, a health issue, or a safety scare, or perhaps they have a serious health condition, or they've reached out to you to talk about this, these are all really important points at which we can start having these conversations about what their priorities are, who their doctors are, what medications they're on, and really getting a sense of a picture around their health, as well as what their hopes are and wishes, and as they age and as they begin to need more support, should that time come, what does that look like to them? And, do they have the resources to enable the type of aging they want? And so we talk about, how do we talk so our parents will listen? And just a few things on that: avoiding power struggles. Mom says, I want to stay at home forever, and you don't agree with that. I think we have to pick our battles wisely. We have to not put, we have to put our energy towards the things that really focus on their health and safety. If there's things that you don't like that mom is doing, like she eats the same thing every night, that's really about her habits and preferences. So we want to prioritize our conversations around matters of health and safety. We always, and we started this conversation talking about ageism, we get frustrated with our parents. We want to say, oh, you don't even know what you're talking about anymore. But we can't speak like that. We really need to use empathetic language as we begin these conversations around our parents' care and their needs, showing them that you're supportive. Really not, as I said, attempting these conversations when people are tired or when there's a crisis taking place, but normalizing these discussions and then trying to work together to come up with solutions about certain issues they're facing. So, Mom, you're not eating enough. How can we think about how to help you with this? And I think the other thing that I can't stress enough is really building a team. If you're fortunate enough to have family members and friends, caregiving is not meant to be done alone. And I think involving your loved one's doctor, getting to know them, painting a picture for them of your loved one's health, of the concerns in advance of the appointment. So saying, I've noticed Mom is forgetting things, maybe calling them in advance. So you're not bringing this up and creating a contentious situation in the doctor's office, but you're giving your healthcare providers advance notice of your concerns so they can do an objective assessment themselves. And really what you're focused on is building this team and this village that you're going to need, because this caring for our aging loved ones is not something we're meant to do alone.
Mm-hmm. I agree. Now tell us about your app and how your app kind of packages all that you've been saying in one spot.
Yeah, thank you. So our app is called CareMobi, CareMobi. It is completely free and available on the app stores for Android and Apple users. It was a project that I developed through my research with the National Institutes of Health, which is why it is completely free. And it is completely secure. And what it really responds to is it is a centralized hub. As I said, when I talked about my father earlier in the program, it's a centralized hub for families like mine to track and share information about their loved ones' day-to-day health. And so what I can't stress enough is, as I said, when you become a caregiver or when someone in your life becomes seriously ill, there's so many moving parts. You're tracking their medications. You're tracking all their appointments. You're trying to remember what Dr. X said, and you're trying to communicate that to Dr. Y. The cardiologist said he should change his medications. You're trying to tell the nephrologist that. The nature of our healthcare system is such that, as I said, it's fragmented and doctors and healthcare providers don't talk to each other. And so what I have found is that family caregivers tend to be the brokers of communication. And often in settings where people are being cared for, like in their homes or in adult daycare programs where I do a lot of research, or even in assisted living, the information from those centers is not getting into healthcare. And 99% of healthcare, I remind people, is not taking place in the doctor's office. It's taking place at home or in the community when you're giving medications, when you're following through on a diet plan, et cetera. So CareMobi is an app that has four main features. It allows families to develop a care team. So if I create a care team for my father, I can invite my sister, I can invite his home health aide, I can invite the adult daycare center, whomever. And I can control who is on the team. And each of us can track and share information about the day-to-day health. We can also have an up-to-date list of his medications. We can receive reminders about when they're meant to be taken. We can track that they've been taken. So I no longer worry whether, somebody has given my loved one their medications, because it's all tracked in there. We have a place to keep track of appointments, and as well as a notes section in there where you can keep track of what doctors have said, as well as questions to ask them at the next appointment, because we all know that when we go to our doctors, we have less than 5 minutes to talk, and research shows we remember less than half of what they tell us. And so this becomes a really important piece. The other feature is the health progress. We can keep track of their nutrition, how they're sleeping, their mood, their behavior, their weight, blood pressures, anything that we're keeping track of at home or that our doctors have asked us to keep track of, so that when your doctor says, how has dad been doing? And you know dad has been an absolute wreck, but dad says at the appointment, oh no, things are great. You can actually paint a data-informed picture for your healthcare provider to say, no, look, this is a video, and you can upload photos and videos, and you can say, this was dad at the daycare center dancing 2 months ago. And now he's been slumped over in his chair all month watching TV. This is not like him. Something is going on. And it can really let people understand what this person's function is like at home, how this is impacting the things they love to do, and hopefully create a more proactive care plan to help maximize quality of life. And I think that brings us really full circle to how we started this conversation, which is getting our family members or whoever's in our village, whoever's helping us advocate for ourselves, to help healthcare providers who are busy and overburdened by painting a clear picture of what's going on, so that we can be better organized advocates for our loved ones' health, because I guarantee you no one cares more deeply than we do.
Mm-hmm. Now, does this app allow for chart sharing?
That's a great question. So that feature will come hopefully, in the near future. What we do create, which I think is a really novel and wonderful aspect of the app, is that it creates a summary of what's been going on. So for instance, if your doctor is really, doctors are busy, so they just want to get to the key data points. And I know that as a healthcare provider. So if we just want to I wonder what, your dad's average blood pressure has been like and weight has been like at home. And I want to know how he's been eating and whether he's been taking his medication. I don't really care about anything else. Great. The app allows you to filter for those things and create a meaningful clinical summary that can be exported. And so you can say to your doctor, it will average, the blood pressure at home has been, 120/80 the last month. His weight has been 150 pounds steadily. He's eaten half his meals for the most part. And so it paints sort of a summary for them overall about what's been going on in the last, couple of months or whatever time period you're interested in. And we found that healthcare providers really love that, because it gives them a clear picture of, not just the last week or the last day or this 5 minutes that this patient is in front of you, but what's been going on. And so right now, that's what we offer, and we're building slowly more and more integrations. But right now, it's more meant to be a centralized place for families to keep track of and share this information. Also, so that you don't have to be, a single caregiver isn't the one that always has to be at the doctor's office. And, I always told my mom, if something happens to you, I need to know how he's been doing, and I need to be able to speak to these doctors so this burden doesn't fall entirely on you. And that's really what the impetus of this had been. And we studied, I just want to say, so much of the research that we did for this was done with family caregivers, with patients, with healthcare providers, with adult day centers. We did hundreds and hundreds of hours with dozens of stakeholders. The app was vetted and effectively created by caregivers for caregivers. So we pride ourselves on the fact that it's incredibly easy to use. We constantly get feedback from people that we're incorporating, but it is really meant to be such a simple tool that if you can use Facebook or you can use Uber, you can use this tool to help track and many of our users are people, in their 60s and 70s. We've even had a 90-year-old spouse of someone with dementia use it. Daycare programs use it to connect with families. So there's an incredible use for people who are not plugged into those EHR integrations that we started talking about, those health record integrations, but it allows them to share the information that they have.
Well, it's a wonderful app. Now, if people want to find out more about the app, more about what you do, are you somebody that offers clinical services, or is that not in your foray?
That is, so that's a great question. So if they would like to learn more about the app itself, they can visit our website, which is www.caremobi.org. They can also visit our social media page, The Enlightened Caregiver, where we give tons and tons of advice about everything from, as I said, how to talk to your parents will listen, how fixes that you can make to your parents' home to make it safer, signs of, dementia versus normal age-related cognitive changes, boundaries we can set as caregivers, things to look for in a nursing home, the whole sort of manual that you need. And all of these resources are free, but I also encourage people to feel free upon visiting those sites and social media pages to please feel free to reach out to me directly as well with questions.
Wonderful. Well, I want to thank you so much for the work you are doing and for taking the time to share it with us here today. I really do appreciate it.
And I appreciate you having me on, and to my thanks to all those listening.
Everybody, we will talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.